Welcome to Lesson 12, Medicare Annual Wellness Visits, from KS Medical Coding Academy. In this lesson, we will learn about Medicare preventive services, including the Initial Preventive Physical Examination, or IPPE, and the Annual Wellness Visit, or AWV. We will also discuss the health risk assessment, routine physical examinations, age-based coding, documentation requirements, and important Medicare coding guidelines. By the end of this lesson, you will have a clear understanding of how Medicare wellness services are distinguished and coded. Let's begin. Before we begin, please note that this training is for educational purposes only. Medical coding guidelines may change annually. Always verify your coding with the latest CPT, ICD-10CM, HCPCS Level 2 manuals, official coding guidelines, and payer-specific policies before assigning codes. In this lesson, we will learn about Medicare Annual Wellness Visits, or AWVs. We will begin by understanding the Initial Preventive Physical Examination, also known as the IPPE, and the Annual Wellness Visit. We will also learn the difference between an AWV and a routine physical examination, and understand the role of the Health Risk Assessment, or HRA. Next, we will review the important coding guidelines for Medicare wellness services and learn how to apply them correctly. Finally, we will reinforce our understanding through practical examples and a knowledge check. Let's begin by understanding the basics of Medicare Annual Wellness Visits. Now let's take a closer look at the Medicare Annual Wellness Visit, or AWV. The AWV is a preventive wellness service. It is important to remember that it is not a routine annual physical examination. A key part of the AWV is the Health Risk Assessment, or HRA. The assessment helps identify health risks and supports the development of a personalized prevention plan. During the visit, important areas such as the patient's medical and social history, medications, healthcare providers, functional ability, fall risk, vision, and preventive care needs may be reviewed. The overall goal of the AWV is to identify health risks, promote wellness, and plan appropriate preventive services for the patient. Now let's discuss the Initial Preventive Physical Examination, or IPPE. The IPPE is also known as the Welcome to Medicare Preventive Visit. Its main purpose is to promote health, prevent disease, and identify potential health problems early. Medicare generally covers one IPPE per beneficiary during the first 12 months of Medicare Part B coverage, when the eligibility requirements are met. For coding purposes, the IPPE is reported with HCPCS code G0402 for the Initial Preventive Physical Examination. Remember, the IPPE is different from the Annual Wellness Visit, or AWV. Understanding the timing, purpose, eligibility, and documentation requirements is essential for accurate Medicare coding. Now let's review the 9 major components of the Initial Preventive Physical Examination, or IPPE. The IPPE is also known as the Welcome to Medicare Preventive Visit and is reported with HCPCS code G0402. CMS requires the applicable elements to be performed and documented as part of the IPPE. Component 1 is the review of the patient's medical and social history. This includes past medical and surgical history, illnesses, hospitalizations, allergies, injuries, treatments, current medications and supplements, family history, diet, physical activity, social activities, and history of alcohol, tobacco, or other substance use. This review helps identify risk factors that may require preventive attention. Component 2 is the review of potential depression or other mood disorder risk factors. The provider reviews the patient's current or past experience with depression or other mood disorders. An appropriate standardized screening instrument may be used when applicable. Component 3 is the review of functional ability and safety. This includes areas such as activities of daily living, fall risk, hearing impairment, and home safety. The goal is to identify limitations or safety concerns that may affect the patient's health and independence. Component 4 is the examination. The IPPE examination includes measurements such as height, weight, body mass index, blood pressure, and a visual acuity screen, along with other appropriate factors based on the patient's medical and social history and current clinical standards. Component 5 is end-of-life planning, when the patient agrees. The provider may discuss or provide information about advance directives, including the patient's ability to document healthcare wishes if an illness or injury prevents the patient from making healthcare decisions. Component 6 is the review of current opioid prescriptions. When the patient has a current opioid prescription, the provider reviews potential opioid use disorder risk factors, evaluates pain severity in the current treatment plan, provides information about non-opioid treatment options, and refers the patient to a specialist when appropriate. Component 7 is screening for potential substance use disorders, or SUDs. The provider reviews potential risk factors and, when appropriate, refers the patient for treatment. A screening tool may be used, but the important coding concept is that the required assessment and appropriate follow-up are documented. Component 8 is education, counseling, and referral based on the previous components. The provider uses the information obtained during the IPPE to provide appropriate education, preventive counseling, and referrals according to the patient's identified needs. Component 9 is education, counseling, and referral for other preventive services. This includes providing the patient with a brief written plan, such as a checklist, for obtaining appropriate screenings and other preventive services. The plan may include recommendations for services covered by Medicare and, when appropriate, the once-in-a-lifetime screening ECG. So, for your CPC exam, remember the sequence: history right pointing arrow, depression risk right pointing arrow, functional and safety right pointing arrow, examination right pointing arrow, end of life planning right pointing arrow, opioid review right pointing arrow, SUD screening right pointing arrow, education and counseling right pointing arrow, preventive services plan. The most important coding lesson is to understand what the IPPE includes and ensure that the medical record supports the services performed. CMS identifies G0402 as the IPPE code, while screening ECG services, when performed as applicable, have separate HCPCS codes. Understanding these 9 components will make it much easier to distinguish the IPPE from the annual wellness visit and to answer CPC-style questions accurately. Now let's learn about the Health Risk Assessment, or HRA, which is an important component of the Medicare Annual Wellness Visit. The HRA collects patients' self-reported information about the patient's health, risks, and daily life. It helps the healthcare provider identify health risks and develop an appropriate personalized prevention plan. The HRA may be completed before or during the annual wellness visit. When completing the assessment, the healthcare team should consider the patient's language and communication needs, health literacy, and any disabilities. The assessment includes important information such as demographic data, the patient's self-assessment of health status, psychosocial risks, behavioral risks, activities of daily living, and instrumental activities of daily living. Psychosocial risks may include depression, stress, anger, loneliness or social isolation, pain, and fatigue. The purpose of the HRA is to identify the patient's health risks and support the development or updating of a personalized prevention plan. For coders, remember that accurate documentation is essential. The HRA supports the annual wellness visit and helps establish the information needed for preventive care planning. For the CPC exam, remember this simple concept: HRA equals patient-reported information, risk assessment, and prevention planning. Now let's continue our discussion of the Health Risk Assessment, or HRA. The HRA helps identify important behavioral and safety risks that may affect the patient's overall health. First, the assessment may include tobacco use, including current tobacco use and exposure to secondhand smoke. Next, we assess physical activity, including the patient's level of exercise and sedentary behavior. The HRA also considers nutrition and oral health, including eating habits and healthy lifestyle practices. Another area is alcohol consumption, where appropriate information about alcohol use can be collected. The assessment may also address sexual health and related preventive health practices. Motor vehicle safety is another important area. This can include safety practices such as seatbelt use and safe transportation. Finally, home safety is assessed. This may help identify hazards, fall risks, or other safety concerns in the patient's home environment. The purpose of identifying these risks is to determine where the patient may benefit from education, counseling, preventive services, or appropriate follow-up. For CPC exam preparation, remember this simple concept: HRA equals patient-reported information, risk assessment, and prevention planning. Accurate documentation of the HRA and the resulting prevention plan is important for appropriate coding and compliance. Now let's review the key components of the Health Risk Assessment, or HRA, as part of the Medicare Annual Wellness Visit. First, the patient's medical and family history is reviewed, including past illnesses, surgeries, medications, allergies, and relevant family history. Next, the current healthcare providers and suppliers are identified. The assessment also includes measurements such as height, weight, BMI, and blood pressure. Cognitive function and potential depression or mood-related risks are evaluated when appropriate. The patient's functional ability and safety are also reviewed, including activities of daily living, fall risk, hearing, and home safety. Based on the HRA and screening results, an appropriate preventive screening schedule is developed. The provider also identifies important health risks and conditions and provides personalized health education, counseling, and referrals. Advanced care planning may be discussed according to the patient's needs and preferences. For patients with current opioid prescriptions, appropriate risk factors and pain management needs are reviewed. Screening for potential substance use disorders may also be performed when appropriate. Finally, physical activity and nutrition-related risks may be assessed as part of the wellness process. For CPC exam preparation, remember that the HRA is designed to identify health risks and support a personalized prevention plan. Always focus on what was documented and what services were actually performed when determining the appropriate coding. Now let's review the 9 important components of the Health Risk Assessment, or HRA, update. First, review and update the HRA using patient-reported information, including demographics, health status, psychosocial and behavioral risks, and activities of daily living. Second, update the patient's medical and family history, including significant illnesses, surgeries, hospitalizations, allergies, medications, and relevant family conditions. Third, update the list of the patient's current healthcare providers and suppliers to support accurate care coordination. Fourth, obtain appropriate measurements such as weight, blood pressure, and other relevant measurements based on the patient's needs. Fifth, assess for possible cognitive impairment using observation, patient or caregiver information, and appropriate screening methods. Sixth, update the patient's written screening schedule. This should consider preventive service recommendations, the patient's HRA results, health status, previous screening history, and age-appropriate services. Seventh, identify and update current risk factors and health conditions, including mental health concerns, substance use risks, and cognitive issues. Eighth, provide or update the patient's personalized prevention plan. This may include education, counseling, lifestyle recommendations, preventive services, and appropriate referrals. Ninth, discuss advanced care planning when appropriate and at the patient's discretion. This can include advanced directives, healthcare preferences, and identification of a healthcare decision-maker. The key point for medical coders is that the HRA is focused on identifying and documenting the patient's current health risks and preventive care needs. Accurate documentation of these components supports appropriate coding and quality patient care. Let's work through this knowledge check. A 66-year-old Medicare patient presents for the initial annual wellness visit, 11 months after the initial preventive physical examination, or IPPE. During the visit, the provider reviews the patient's medical, family, and social history, evaluates functional ability and cognitive status, obtains appropriate measurements, identifies risk factors and health conditions, and completes the initial health risk assessment. The correct answer is G0438. G0438 represents the first annual wellness visit, including the development of a personalized prevention plan of service. For the CPC exam, remember this important distinction. G0438 is used for the first AWV, while G0439 is used for subsequent AWVs, when the applicable requirements are met. Always code based on the provider's documentation and verify the current Captain and Medicare guidelines. That completes this knowledge check. Thank you for joining us for Lesson 12, EM Medicare Annual Wellness Visits. In this lesson, we covered the important concepts of annual wellness visits, the IPPE, health risk assessment, and related Medicare coding guidelines. I hope this lesson has strengthened your understanding and increased your confidence in medical coding. Keep learning, keep practicing, and always code accurately using the latest official guidelines. Thank you for being part of KS Medical Coding Academy. Keep growing, keep improving, and I'll see you in the next lesson. Thank you.